Welcome to RT330 Clinical Instructor Training. Thank you for watching this video. This course covers clinical practicum in neonatal and pediatric respiratory care. Students will do 7 shifts. Lucille Packard does 8 shifts. We have other locations, and we're really thankful for all of you: Lucille Packard, Benioff Children's, KB Oakland, Alta Bates, KB Santa Clara, Kaiser Oakland, Santa Clara Valley Medical Center. There's so many of you out there. So I want to thank you. As far as instructor's requirement, it's 2 hours requirements to meet the student. And in the 2 hours, you are just covering you meet the student for the first day for an hour. I give you some flexibility. If the student is nights, you want to have them stay over, that's fine, or vice versa. You want to come in early and have them come in 1 hour early, that's fine. But it's very important that you send in a welcome email to the student once I email you who the students are. It allows the students to feel comfortable. They feel that they're welcomed. They're going to be successful. To help you with that, there is an email template that I've created for everybody, and you can use it down here, and you can just fill in the blanks. Basically, what we need is the following. We need parking information. We need where the department is. We also need the phone number for the lead therapist if the student is not well and they need to not leave a voice message and instead talk to the lead therapist. These things are emphasized in the course when I give an orientation to the students, but please also emphasize this to the student. Give them the number from the get-go. Provide phone number to call in sick. I would emphasize that you should call an hour early if you can. And then when you're meeting with the student for the first time, give them the date and the location where you could meet with them. And the students are basically expecting someone there to have some sort of guidance. So in this case, you don't really have to meet the student in the middle, but if you want to do 30 minutes in the beginning, 30 in the middle, it gives them this confidence. But sometimes most students want 1 hour in the beginning to get where to put their backpack, where's the restroom, things of that sort too. The student, what you're looking out really for is anything that is missing. Are they late? Are they disrespectful? And are they doing their assignments that are due? So if you are around and you want to do a quick check on them, you can look at their folder, and you can even ask them, email them, where are you with your case study? So they have a case study in this rotation. It is a 2 days duration. They are gathering ventilator data, patient information history, labs, x-rays, everything, but it has to be a NICU patient. The NICU patient, specifically because it is very important experience for them in this course. And they do have an assignment in PICU as well, which is they take a PICU patient and they write a SOAP or SBAR assignment for me. When you are talking to these students, you can email them and follow up on the 5th, 6th shift. Hey, your rotation's about to end in a day or two. Have you finished your case study? Because if they do not finish the case study and submit it to me, they will not pass the course. Keep track of the student progress and check in with staff, and especially the purple packet evaluations. I want to remind you again that we're going to respect the students' privacy because the FREPA laws, of course, protect them. We are not going to discuss any student information if it does not pertain to that particular therapist. If the student is giving any sort of trouble, the best thing to do is to go to the side, discuss the student issues, write down the date and the time particularly. I'm going to pause and move down here where we have a log example, and these are real examples. Somehow our formatting is not cooperating, so we will go down here and look at it. So at home somewhere in private where you can keep a log of the student that you meet every day is the best practice as an instructor. This allows you to track back what has happened. For example, we have a student, we have the date and the timestamp. It's very essential. Student gave a political comment. You can go into details if you like, but we want to stick to the facts, what happened. So they gave a political comment. It's not appropriate to have political conversations. So you guide them. So this is CI or RT report, specific names needed. So if it was another therapist, you should know who it was with. Was it with the patient, which would be terrible. Basically, we're refraining them from political topics and any other topic that's controversial. And then once you've done that this is what the student did, you have to look at the outcome. You have to say, I spoke to the student on this date, this time, and I told them not to do this ever again. And what did the student say? Those should be all documented. You can actually use your own style. This is just an example. The next example we have is another day later. The student pulled out oxygen from the wall and the patient was in a dangerous situation. This is a real case. The RT was the clinical instructor, told the student never to remove oxygen. In this particular case, the student was told probably 10 times that what this is a flow meter, this is a nasal cannula, just don't take it off. Student was very defensive, but this particular clinical instructor had meticulous charting and notes on the student's behavior. So you are really looking for patterns. And if you catch them early, it's perfect. I need to know them. And you, of course, need to document that you notified the student that what they did wrong and how to improve it. And how do you know if they did something wrong? Is right in the daily log and your ability to be able to talk to the therapists that work there. Every single day, the student receives daily evaluation. They have a rubric at the front. At the back actually, and the front of the page looks something like this. So students have actually complained in the past, I don't know if I'm allowed to ask for what I want. I have a goal that I want to learn something. So students' goals go here for that day. They fill it out before they come to the clinic. And then the RTs will comment. RTs tend to not give negative comments, if you've noticed. Vast majority will say nice things because the student's hovering over them. So make sure that you're actually communicating with your team members to give authentic feedback. It should not be biased feedback. It should be authentic by all means. There's a note that they need to flip the page, and then I gave them a little spiel that, hey, if the student's getting 1 and 2, please, it's for improving the student's behavior and really segueing new generation respiratory therapists that are professional. So this rubric focuses on a few things here: safety, care, patient care, professional behavior, communication, and clinical development. I want to remind you, 2 and 1 are a failure for that day. If every single day or every other day they're in this group, that's a problem. But definitely encourage all staff that Ohlone College demands, and please help us out. That we need authentic. It's actually, there's a term called IRR, inter-rater reliability. Basically, you want to give the true feedback the student needs so they can actually improve and be successful in their career. Please, if you can, that would be just wonderful. So here in area 1, student jeopardizes the safety of patients, self, or others, violates HIPAA. If this happens, they go home and they're out of the program, but I need meticulous documentation, date, time, and whatnot. Who was it with? Some of the details. This can go up to dean and to the president, so it's really evidence-based. And then we have procedures performed without patient safety in mind may need reminders about safety. So they're kind of careless here, and you want to really have them at least be average. That's what all we're asking. And if the student's saying, can you give me a 5 when they're actually a 3, you say, I'm doing this for you. You will be in the excellent region one day, because honestly, if you read through the excellent portion, it's really for folks that are very, very experienced. You will have students that are excellent, no doubt, but please give and ask for authentic feedback. I will attach this rubric. Please read it carefully. You should know this rubric in and out, inside and out, so you can actually coach the student. Then I'm going to go back up here because we have covered basically how to help the student gain their rotation and be successful in it. At the end of the rotation, you need to complete a final affective evaluation, and it needs to be on time. Otherwise, they will not get their grades posted, and their transcripts don't turn out well. So please, please do the affective evaluation right away. Make sure the student is aware. Email them and CC me, that because students will complain. My clinical instructor doesn't give me a evaluation on time, so I don't want to really hear that. You guys are wonderful. You worked so hard. Um, After that's done, you're definitely looking for the yellow card entries that I'll share another video. You'll see it's a separate video. Make sure you sign off at the very end of it. Check all signatures in the purple packet, and instructors must keep the log. Again, I'm emphasizing, please keep a log and be specific about what the event happened, especially the negative ones. Document events with date and time for disciplinary issues. For example, no call, no show, safety issues. Please see the clinical rubric. Plus, we also have a policy in our student handbook, which entails that if they are no call, no show, they get 4 points off. And if they earn 8 points during the semester, they can be let go from the program. Become really strict, because I don't really appreciate them not respecting hospitals and not taking care of their basic student duties. Um, so remember that we're gonna look at the daily evaluations, the front and the back, carefully. Talk to the therapist in private, and correct the deficiencies right away, and document that you did do that. That way you have a log going back, whatever has happened, that you actually took care of it. As the student have they finished their capstone project, if they tend to be shy sometimes, they might ask for an x-ray, specifically the report. You can help them with that, or any lab values they're missing. And then the final after evaluation, helpful hint here is that you need to encourage students with the sandwich technique. Start with something positive they've done, then go with something that they need to improve, and then end it with something positive. So they leave feeling that, oh, I've done something right, but I really need to focus on something that's going to improve them as a therapist. All right, this is the last bit of this video. I have videos for you that I'll be posting. You can see that right here you have the data arc, how to do the data arc, and you also have your timesheet and yellow card, how to do it. Timesheets are very specific. They're sampled here, which I go over in the video that is linked down there. So please let me know if you have questions, and I'll see you at the training session. Bye-bye.